Hi, it's Dr. Susaye Rattigan. I'm a clinical child and family psychologist with Thrive Behavioral Health and Counseling Services in Montego Bay. And so I want to answer a question that I find that almost every client asks me when I talk to them in the first contact. And that is like, what to expect in their session, right? So, the first session is really an important session for both of us, because as a therapist, my job is to get to know you, to understand what it is that you've been experiencing that brought you to therapy, to set the tone for our relationship moving forward, and to get your buy-in to therapy. That's what I view my job as. Now, as a client, your responsibility is to get to know me, to get a feel for our fit, to see if we're a good fit, to get any questions that you might have answered, and just to understand what it is that you're entering into, right? So that those are the two major roles that happen in our first session. Now, generally, when you come into a session with me, before you even get into the session, you probably be sitting in the waiting room. And I don't know that you'd be bothered, because generally when clients come to see me here, nobody's asking them any questions. I'll generally come out and I'll greet my clients and bring them back with me to the room. But then when we get into the room, before anything else happens, I'll discuss issues of confidentiality. So that the fact that our relationship is confidential, and the issues that might stop it from being confidential, and what my job is. So I'll explain all of that. I'll also provide you with a consent form. That means that you agree to working with me and that you understand what we're going to be doing and the limits of confidentiality. Sometimes I'll send it beforehand as an online form, and you can fill that out and ask me any questions in the session. And sometimes I'll provide you with a paper form, depending on if enough time has passed that I was able to send you the form. After that, we try to set an agenda for the work that we're going to do. So after I find out what it is that is bringing you to therapy, then I'll tell you a little bit about how I work and what the expectations are for therapy and what my job is, right? And then after we do that, then we can delve a little bit into your history. What has been the history of this problem? How have you dealt with it before? Who is it affecting? What are your goals? What do you wish to see happen in the future if we should work together, right? And that's all that happens in the first session. And then maybe we'll talk about how frequently we meet. Generally, I start off meeting with my clients once a week until some progress has been experienced, and then we might shift to every other week or once a month. And then how long the sessions are. Sessions are generally an hour long, and that's pretty much what we cover in the first session. It's an easy, laid-back session generally, and I try to put out any fires or emotional emergencies that you're experiencing in that session, and then we reschedule for the next session, right? So that's it. I said it's a low stress sort of experience, but I know that it's important to understand what it is that happens in the session. So if you have any questions, please put it below the video, or you can send me a message. My phone number is 876-833-5094. And again, you can find me on any social media platform as Dr. Susaye. All right, talk to you soon.